And if I go about 1.5 inches out, I'm on bladder 6. If I touch these individually or at the same time, nothing happens. All right? It's negative. But the moment you take the torque out, it loads the gun. Take your hands down. Now, how do I take the torque out? There are many ways. If you got a drop section on your table, take the side that's too far forward and just push it down. You can lay them on the side and sort of give this side, push it forward. There's a lot of different ways to do it. I could raise the lower side and just gently, don't try to move the ASIS, anterior posterior, try to push the whole pelvis straight to the floor. There's nothing to fixing it. It's easy to fix. Is that fixed? Redistort the patient, see if they weaken. That's how you know whether you corrected it. If it's corrected, no weakness will be there. And I'll show you where the slight mistakes were made on people. Now she doesn't weaken. Fingers here. Who causes, Walther says it's perpetual wrong. He says it gives you other things. No, it's your two. Your two, 99 out of 100 times, is the cause of switching. Okay, either way? Put your hand next to the scalp like you did before, and keep the hand away from the rest of the body. Now here's my question to the patient. You're no longer right-handed, left brain dominant? Of course you are. What was this a sign of? It's a sign of switching. That's why this nonsense is still in all these books. This means, yeah, it does, but it's a sign the circuitry is off. That's all it's a sign of. If it's no longer there, now if you put your hands like this, it's no longer, and you can do it either way. And if you look at the Schwartz sticker, she'll weaken if she looks at the American Indian Schwartz sticker going counterclockwise, and if you're left-handed, you weaken to the German one. It's not that it comes from Germany, but that's the one it became. It's really what it meant. So there was an ounce of truth to it, but there's all this stuff purporting what it doesn't mean that. It means it's switching, which is important because you're going to get something wrong. Believe me, we've done this many times. How am I yours? Sometimes. I'm the opposite of everyone. Can't tell you why, but I'm right-handed. But once you fix it, it's gone. But watch what happens. If she touches bladder 6, or if she sits bladder 50, they're all going to sit before they leave the office. They will undo everything you have fixed for them. It takes the UR2, brings it back, brings back switching. If you fixed any cranium, it, undoes the jaw joint, screws everything up again. So I had to find a way of not having that happen. So what happened? The 18th patient who came in, it didn't affect her, this thing of, I'll show you in a moment. It has nothing to do with glasses, so take my word for it. She touches bladder that way with one hand, one side at a time, nothing will happen. Take it away, about the same spot. Simultaneously, no. Now put both of them on, watch what happens. And if you looked at the pelvis, you would have seen it just come up, not a lot, but it moved up again. And what's back? The whole damn shebang. Put it here. This, I think, is very important. It doesn't take long to fix. I'm just elaborating, but I want to show you how we ended up getting there in the first place. That's back. This thing with the hand comes back. Take the hands away. Redistorting it comes back. I've undone it all. It's easy. I can get rid of it on the spot. Don't have to spend a lot of time talking about it, which means I got to redo you. So no big deal. Now, the reason I say you need to do it, because they're all going to sit. They may not touch their head. They may not put their glasses there, but they're sure as hell going to sit. And now, what I usually do with a patient, I look at them. If they look like they're up on one side, I flatten it down. I've checked this first, flatten it down. If this doesn't weaken them anymore, forget it. I do one other thing, and I'm finished. It takes 15 seconds. So it's not long. This is not going to put you 25 people behind schedule. I take the torque out, but here's the reason I tell you this is important to do. Would you turn and sit? Just turn and sit. She's now sitting on bladder 50 simultaneously. Lay down, it's back. We're back right where we started. Keep it there. And this was something I found this later on. The 18th patient, it didn't affect. What did she do? I asked her, what do you do different? She said, oh, in a textbook she had gotten that I told her to get. I treated her. I wasn't using neuroemotional, I'm using thought field therapy. She had taken an auto accident. There was a lot of emotional upheaval that went with it. I used this TFT to help her. It worked fine. I said, if you want to know more, get a book. She got the book, read it, and in the book they tell her, whack your head here. She said, I'm tapping my crown chakra, if you're familiar in yoga, the chakra areas, and my third eye. That's what she said to me. So my assumption was, well, maybe that's why it didn't affect her. Wrong answer. Wrong answer was she wasn't distraught. I didn't see the connection. But that became the method of fixing it. And I had a method now that I could fix this for the patient, and we have to repair it again. And I could do this over and over. I didn't do any of these things once. Believe me, I've done these enough that you got to retake it out. Now, I could take it out. Now, I can challenge her if you don't want to, you don't have blocks, all right? Does she have it? I got a strong muscle here. Put it down. I take the two under here at the PSIS area, lift them both at the same moment, push hard, and do the same thing. The block is just a static way to keep it in the distorted position. If you look at it, it's what George had called body into distortion. Sometimes the body won't give me any information, so I may distort them and see if that produces a signal for me. Or I ask them to shift their eyes into distortion. Shoulders a little higher, so I make them put the eye up or down. It opens cerebellar pathways. And the cerebellum, as George said, compares, computes, and compensates constantly, and does such a good job most of the time, it makes it invisible. The system doesn't know it's there. And if you can't find it, you can't fix it. There's all different ways to fix this. If she were laying face down, I'd take the sides too far back, use the drop section, just push it down. It doesn't matter how you start. Here's what you see in the book. Would you turn that direction for me, please? Here's the other way that he shows it. Why bother? This is too complicated, takes too long. He takes the pelvis, brings you sideways, keep the bottom leg like that. He takes the leg and asks the person, because if you ask them to push against you, they're invariably going to straighten the leg on you. So you ask them, keep the leg bent, push it into me. Steady pressure, steady pressure, steady pressure. And I just shove the whole pelvis forward this way. Lie on your back. But that takes too long. I do it the other way. They used to do this test face down. Why would I wait? I'd forget to do it. That's why I did it face up. All I do is check. I look at them. If they seem this, I touch here. If it weakens, I take it out, and I'm done. I have to do one other thing. I have two choices. The one thing that always seemed to work, I've had a couple of exceptions and I had to do more than that, is the woman was tapping here. Well, there's no meridian point. There is one on Felix Mann's chart. He calls it 24.5. 24 and here. So you can either wrap along the center line, and that'll change range of motion, changes blood pressure. There's all sorts of strange stuff if you tap it for 30 seconds. But that's a lot of time in what I need to do with a patient. And I could do a lot of other important things I need to do in the time I have allotted. So what I found works pretty much 99%. You'll always get an exception, is the glabella correction. You press in between here to the EOP about 4 or 5 times. I compress the skull. You can add the movement of the fingers if you want to. I'll do it from this direction. I put my hand on in, and I compress. In, and I compress. In, and I compress. One more time. And I went and experimented until I found out what the points were. I have to know how it works, so push out. Now somebody will ask me, well, why does it distort them? I don't know. I haven't figured